Warm welcome to the new episode of Ink and Insights. My guest today is Sanjeev Sarma Katel. He is a pharmacy officer with the Nepal government, Ministry of Health and Population. He has over 10 years of experience in regulatory systems and organizations, including Department of Drug Administration and its regional offices, National Medicines Laboratory, Department of Health Services, and the General Secretary of Nepal Pharmaceutical Associations. He has been working as a government regulatory officer in pharmaceutical sectors, drug analyst, and management of healthcare with an objective of enhancing the health status of people through proper management of pharmaceutical services, regulation of medicine, medical devices, and health commodities. On the eve of World Pharmacy Day, we'll talk about the status of pharmacy in Nepal in today's program. Sanjeev, thank you so much for your time.
Thank you. Thank you very much.
So, Sanjeev, let me begin by asking what is the significance of World Pharmacist Day, especially for the pharmacy profession in Nepal?
Uh, pharmacist sector in Nepal. It have a short history, not a long, and it has a recallable history. And as a executive member of Nepal Pharmaceutical Association, which is an organization having more than 50 years. Old organization. All the pharmacists, they have a significant role on the healthcare system, and now the government also have been recognizing our effort, and that's why it is the World Pharmacist Day, which is celebrated in September 25 each year with a theme which is provided by the FIP, International Federation of Pharmaceutical, and it provides an oversight for the government, for the stakeholder to explore the role of pharmacist.
Right, right. And how do you think is the role of pharmacist in Nepal that's evolved over a period of time in the country's healthcare system?
Yeah, before 50, 60 years, the role of pharmacist was not recognized. And then after that, the draft and implementation of Drug Act 2035 and the different regulations were made. And also for the regulation of pharmacist in Nepal, Nepal Pharmacy Council Act was drafted, implemented, and the council was established, which helped to regulate all the pharmacists in Nepal. And yes, they have a significant role. Before the industrial sector of Nepal, there are just few industries in Nepal, and currently there are more than 100 pharmaceutical industries. I'm talking about allopathic, these industries. And in those industries, 100 of pharmacists, 1,000 of pharmacists are working there as a quality control officer in the regulatory affairs, as well as for the formulation and overall quality assurance of the product. And not only this, and now coming to the role has been shifted nowadays from the industrial role to the clinical aspect, where most of the role in hospitals of the pharmacist regarding the patient care rules, regarding the patient counseling, providing the drug related information about the appropriate dosage form, and overall clinical services that used to provided in the hospitals also. And apart from that, pharmacist has a vital role in the pharmaceutical supply chain management also. It includes the procurement, it includes the storage, distribution, and ultimately up to the patient. So there's a huge importance of pharmacists in the public sector, in the procurement sector, and in the private sector as well.
Yeah. And, can you shed some light on the current state of pharmacy practices in Nepal's public healthcare sector as well as in private sectors?
Yeah, in public sector, and the role for governing the pharmaceutical supply chain, the government has established the Department of Drug Administration. It used to control the manufacturing, sales, distribution, and export import, all the activities regarding the drugs. and pharmacists are engaged there as a drug inspector, as a regulator to provide the quality, safe, and efficacious medicines throughout the country. So it's from the public aspect, there's a government bodies who are regulating the medicines, and also in the supply chain management also, likewise supply of vaccines and other essential health commodities to the public. And also the government has a commitment of providing free basic healthcare services, out of which there are a lot of essential medicines which are distributed at free of cost. So the government of Nepal has established the channel and pharmacists to work there in the supply chain also, to provide the quality medicines to the people of Nepal. And I'm talking about this as a in a public sector. And apart from that, the Ministry of Health and Population, it draft, implement, and regulates different policies, framework for effective development. And in a hospital and service sector also, and there's a vital role of the pharmacist in hospital pharmacy. Recently, the government of Nepal has implemented the hospital pharmacy directives and implemented health insurance program, out of which the hospital pharmacists, they are responsible for distributing the medicines, providing counseling service to the patient, and overall enhancing the quality of service that are provided to the patient by regulating the medicine sector.
And what do you think is the situation of private sector in terms of enhancing the pharmacy?
Yes,
How much do they contribute to overall?
Yes, I've just talked about the role of pharmaceutical industries and their development and the input of the pharmacist also. A lot of pharmacists are engaged in the pharmaceutical company for manufacturing the quality drug product. And apart from that, in various hospital pharmacists, private hospital also, a lot of pharmacists are engaged there to provide the pharmacy service. And in academic area also, we have pharmacists, and apart from that, pharmaceutical marketing, there are a lot of pharmacists working in the marketing sectors also.
Okay. And what challenges do pharmacists face in rural areas of Nepal?
Basically, in rural areas, pharmacists, due to the geographical difficulties, only a few of the pharmacists been able to be at the rural area and serve the people of that particular area. And most of the difficulties, there's a difficulty in upgrading their knowledge, and also difficulty in getting the develop CPD trainings and other things. And also there's a lack of job and lack of proper services at the rural areas of Nepal.
Right, right. And what is the situation, overall situation of pharmacy education in Nepal itself?
Pharmacy education now, I think there are more than 50 academic institutions, university, college, and training centers, those who are providing the pharmacy education. And I think before 30-40 years ago, CTVT, Council for Technical and Vocational Training, CTVT has started the diploma in pharmacy or mid-level pharmacist employee. And currently, I think according to the Nepal Pharmacy Council data, there are more than 15,000 assistant pharmacists, registered assistant pharmacists, and bachelor in pharmacy. There's a program, masters in pharmacy, and PhD in pharmaceutical sciences, in pharmacognosy, and various other topics. The major topic, bachelor in pharmacy, it was started in I think 1995, initiated by the Kathmandu University and followed by Tribhuvan University, Purvanchal, and Pokhara University. And about more than 5 universities and about more than 40 academic institutions, they are teaching the pharmacy pharmacy subject, but yet there are some of the challenges because of lack of proper harmonization in the syllabus and lack of proper facilities for the appropriate training to the students, and also there are other limitations also, other limitations and factors that could hinder the education pharmacy education system in Nepal.
Right, right. And how does the government of Nepal ensure that the continuous education and training of pharmacists is met to that of the international standards?
From the government perspective, there has been a little approaches to enhance the proficiency of the pharmacist, but us from our perspective as a part of our organization, we had recently started the continuous professional development training in collaboration with a different with our different partners like Pharmacy Council, with the USAID, USPPQM Plus, and the government Department of Drug Administration, to promote the technical efficiency of the pharmacist working in the community, working in the hospital, and working in other various sector of pharmaceutical sciences. But till date, from the government point of view, there is still a lacking. I need to say it frankly, there's a lacking from the government perspective in proper implementations of those sort of training and practices to the pharmacist. But yet there are some of the few attempts, like is the training on the good pharmacy practices that was done by Department of Drug Administration, along with the association of various other partners.
Right, right. No, I was about to ask about your organization.
Yeah.
What is the importance of Nepal Pharmaceutical Association that you are associated with to establish the role of pharmacists in Nepal?
From the beginning time, this association had been advocating in the for the rights of the pharmacist, for their professional duties. Also, before that, there were no any policies regarding the regulation of pharmacists, and NPA plays a pivotal role for the framing of different act, policy, and guidelines. And also, Nepal Pharmaceutical Association is a member of Drug Advisory Committee, which is a technical committee presided by the Secretary of Ministry of Health and Population, and from where different sort of policy regarding the health, regarding the medicine use, that used to be framed. And our organization always provide advocacy and help to lobby for the different sort of our professional rights and activities. And not only regarding that, for the proper allotment of the job for pharmacists also. And sometimes we need to talk about the remuneration of the pharmacist as well. So there's a lot of activities that used to be conducted by our association, and it's not limited and are just focused to just a particular area.
Okay, so it's diverse. Okay.
Yeah, it's
And
diverse.
so, how has Nepal's pharmaceutical private companies have contributed to the drug production in Nepal?
In Nepal, the production sector also initiated from I think 1972, the first company, pharmaceutical company of Nepal. And from that time period up to now, there are more than 120 pharmaceutical company which are operating in a quite strength manner, and they are basically manufacturing different sort of doses from like tablet, capsule, injectable, suspension, liquid doses from, and other various sort of doses from. And I think about more than about 50% of this market has been occupied by the domestic pharmaceutical sector. I think it's a good sign, but yet, according to the national drug policy, it aims to make the countries self-reliant in the production of drug. Although this has not been achieved, but it's in the direction of self-sustaining for the drug production. And yet some of these companies, these pharmaceutical companies, in the formulation, in drug development and design, and they are well equipped and also capable to export their product to the various other countries also. If the government provides an appropriate platform, then they are ready to export the medicines also.
So, are our companies already started exporting it, or there's not enough policy
And there are
environment?
few attempts. There are few attempts by one or two pharmaceutical company, those who are exporting the drug, but it's not in bulk volume. Yet, if the government recognize that needs and set up an special, and make an arrangement for their, which make an ease for their export, then they are capable enough. And so I think this drug manufacturer also, they need to lobby on this particular topic to the drug regulatory sectors and to the ministry as well.
Right, right. And how much do we import in terms of medicine in our local market?
Yeah, 50, more than 50% is of those medicines, and which are new drug delivery system, especially the critical medicines, and most of them are injectable anti-cancer medicines and immunoglobulin vaccines. Those medicines are not manufactured here because it needs an expertise which is not available here also, and which the company cannot afford to manufacture. Still, that's an areas for the improvement to those industries also in those particular medicines.
Right, right.
Yeah.
And can you discuss the role of pharmacists in the government's public health programs, such as vaccination drives and disease prevention?
Yeah, Department of Health Service is responsible for providing, supplying all those vaccines and essential health commodities to all the other provinces, and also there is a provincial structure. There's a local structure also, which have a structured supply chain environment, and in each of them there are technical manpowers, including the pharmacist also, but in a very few number. There's a need for pharmacists, although there are very few number of pharmacists who are working there in a permanent manner, and most of them are recruited on a temporary basis. So the government also need to assure about the position and creation of new position of pharmacists in the supply chain system, in the central level, in the provincial level, as well as in various other sectors where there's an involvement of drug and its distribution channel.
Right, right. And sometimes it's often been said that, the government's regulation itself and monitoring itself is pretty weak in terms of, keeping monitoring on the supply chain in country. How does the government regulate and monitor the pharmaceutical supply chain in Nepal?
Yeah, for monitoring, I've already told that it's a role of Department of Drug Administration. But unfortunately, we have to say that its regulatory system is comparatively weak in Nepal, because there are a lot of areas to be covered, including the registration process, including the regulation, including the inspection and detection of counterfeit and other substandard medicines, and also the DDA, it act as a quasi-judicial organization, which also impose fine and other various penalties, and took the offender to the judicial court also. So there are a very limited personnel who are working there as a government sector, and the government also seems reluctant to fulfill those positions or expand the role of DDA to different provincial provincial level, enhance the quality control mechanism by establishing the National Medicines Laboratory and its organization in different provincial also. And to say, according to WHO, it used to conduct the global benchmarking for every country's drug regulation. And in 2019, Nepal's drug regulatory agency was listed in a, level 1, which is out of level 4. So still after 5 years also it's in the same level. That's mean there is a the unwillingness from the government part also, some sort of mismanagement also there, and the inefficiencies of leadership to advocate all those issues and strengthening the system.
Right, right, Sanjeev. So one of the other areas that I'm very interested in, and which is very common, is we in our society tend to use antibiotics very easily, right? So is there
Yeah.
how is the Nepal government promoting responsible antibiotic use and addressing antibiotic resistance in pharmacies across the country? Is there any plans in place?
The rampant use of antibiotics has been global issues, including Nepal. But in Nepal, the trend of over-the-counter sales and distribution of antibiotics has led to critical situations, especially by the paramedics, by other health workers, and also by the pharmacists as well. So, Nepal government, Ministry of Health and Population has recently implemented the National Antibiotic Treatment Guideline in 2023. It is launching this guideline through its applications also, which make it accessible to all the other public also. And Department of Drug Administration has also issued various notice regarding the use of antibiotics in human as well as for the veterinary provisions also, and it restricted some of the combinations of antibiotics whose particular use could be harmful to the public, and also special attention and focus by the government to tackle the challenges with the antimicrobial resistance. And there has been various advocacy regarding the rational drug use, regarding the irrational uses of the various sorts of antibiotics. And there need to be from our association perspective also, we are planning to conduct such awareness program to the various people, to other health worker also, or to other public also, regarding its use, its impact, its complications regarding its use.
Right, right, Sanjeev. And one of the other areas that common people quite often face is that whenever they are hospitalized in government hospitals, they're generally given the free medications, right? So, but some of the prescriptions, or rather, most of the prescriptions made by the doctors are those medicines that's not available within the hospitals, and they have to go outside and buy those medicines, right? So, what measures are in place to ensure ethical practices and prevent corruption within the pharmacy sector in Nepal?
Okay. Nepal government has implemented the hospital pharmacy directive in 2070 and back in 2072. But the government allocated the seed money in 2075 to establish the hospital pharmacy of their own, and recruiting the pharmacists and other manpowers to provide the pharmacy service from there. But its effective management and it's also monitoring and supervision is also not yet properly evaluated. And the same pharmacy is responsible to provide the essential medicines free of cost, as well as the medicines that are to be reimbursed by the National Health Insurance Program, and and the other medicine also. So there are a lot of branded medicines which could not be available in the particular one pharmacy, but government has also an policy to prescribe prescribe the medicine in a generic version, so that while prescribing the medicines in a generic version, it will be available to the available in the pharmacy also. And apart from that, what the government has requested, that each hospital should have their own drug and therapeutic committee. It's a technical committee which is responsible for allocating the list of pharmacy in the hospital, preparing the formulary of their own, and it involves a multidiscipline, including the doctors, the nurses, the administrations, and the financial administration, and the pharmacist, who make a decision regarding the availability, regarding the costing, regarding the list of all those medicines. While making the DTC effective, I think
Mhm.
those all issue could be tackled. And there are few other issues also in the market. Likewise, the distribution of nutraceuticals, so-called nutraceuticals, in the name of medicines. The
Mhm.
patient will get confused whether it is their medicines or it's just a nutraceutical supplement which is available in the medicine dosage form. It's not the medicine. It's not been regulated by the DDA, and it's given as a food. But some
Mhm.
of the doctors and some of the health institutions, they used to prescribe those, and it has been a huge burden for the patient, in terms of financial condition also, and in terms of health also, because those products are not assured. Their quality, safety, efficacy has not been accessed. So it's also a concern regarding the availability. Those
Mhm.
doctors who prescribed nutraceuticals, and those are not available inside the hospital pharmacy. So people used to go to the private pharmacy for purchasing those sort of medicines.
Right, right. Looks like lot many policies and directives in place,
Yes.
and very few of the monitoring and mechanisms to sort of ensure that things are done in a proper way. So perhaps my last question to you for today's program is, looking forward, what do you think are the government's priorities for strengthening the pharmacy sector and the roles of pharmacists in Nepal's healthcare system?
Um, First of all, the academic sector need to be strengthened. Without strengthening its, the base will not be effective. So there need a strong commitment for all those academic institution, regarding the council, regarding the ministry, to establish to establish health manpower resources who is technical enough, who is capable enough. And the second one, and the government should show their strong commitment towards the people, because the constitution of Nepal has provided the free basic healthcare services as the fundamental rights. So, in order to deliver the fundamental rights to the public, the government should assure a strict regulatory mechanism, and that mechanism should be in all the provinces. Till now, there are just only three different regional offices of DDA, and about 117 manpower, altogether manpower. Out of them, only there are 30 or 40 pharmacists who need to look after the 30,000 pharmacies all over the nation, and about 120 manufacturing industries, and about 400 import. And apart from that, they need to look after these counterfeit medicines, substandard and falsified. So there's a huge gap between the regulation system and all those issues regarding the medicine. So second one is the regulatory system should be strengthening, including its laboratory system and other things. And also the third one, there are various health commodities which are not regulated yet. The quality, safety, and efficacy of those devices, medical devices, and cosmetic agent and reagent, they are not regulated till now. So those need to be regulated by the DDA, and the act should be reformed. We have an act which is 50 years old, so that need to be reformed. And according to the decentralization, that the DDA also need to be decentralized. And the third one is that there should be an effective role of pharmacist in the supply chain management also. Though there are very limited provision for pharmacists, and that need to be increased. So these are the overview that need to be improved in the coming days for pharmacists.
Right, right. Looks like there are a lot many things that needs to be done. But
Yeah.
Sanjay, thank you so much for your time. It was lovely talking with you.
Thank you very much for allowing your show as a platform to express our word. Thank you again.